With all of the recent changes due to the COVID-19 pandemic, I know that in some cases it's becoming harder to obtain veterinary appointments. Stress over the health of our pet is high in normal circumstances, and with the current state, it's even higher, not knowing whether or not we're going to be able to get the proper care for your pet that's needed. One of the conditions we see that causes the most stress normally is intervertebral disc disease and other neurologic conditions. We made this brief webinar to help guide referring vets and clients in their pet's neurologic recovery and give them some options of things that you can do at home. So the goals of this talk are not to replace veterinary medicine or an appointment with your veterinarian, but hopefully we can give owners and referring vets options and some guidance in some of the things that that you can do at home. And we can discuss options for dogs with some of the more common neurologic conditions. So what neurologic conditions can rehab help with? Well, knowing that the goal of rehabilitation is to restore mobility and help with balance and proprioception and strength, really any neurologic condition can benefit. Sometimes, again, the goal is not to cure the neurologic condition. We see dogs with geriatric vestibular disease and degenerative myelopathy that benefit from rehab, but basically we're slowing the course of disease as opposed to curing. While this talk primarily is going to focus on IVDD or intervertebral disc disease and conservative management or post-surgical management, many of the things that we're going to discuss can apply to other neurologic conditions as well. So just remember that dogs with neurologic disease can be affected in so many different degrees. So we can have dogs that are completely paralyzed, all the way to dogs that may just be all of a sudden refusing to jump up on the couch or do the stairs and are just a little off. Controlling pain in these patients is essential. We have both pharmaceutical methods or drugs and non-pharmaceutical methods that we can discuss that can be used at home and help owners get a better handle on things. Again, a proper evaluation from a veterinarian or a rehab veterinarian can help assess where your pet is in the disease process and in recovery, and then we can give you a better, design a better program for you to do at home, especially during this time. So let's talk about home care. So one of the biggest things is rest and confinement. So these patients, especially if they are not undergoing surgery, it is essential that we have them confined to a small area, whether that's a cage or crate or a very small area like an X-pen with non-slip surfaces is essential. With conservative IVDD, so you're not pursuing surgery at this time, maybe it's not recommended or maybe your pet is not a candidate, at least 3 to 4 weeks as we wait for that scar tissue to form in the spinal cord. Rehab is crucial still in these stages, but maybe passive range of motion and some massage and things like that are all we can do, but still confining them is super important. The more we let themselves drag around by their front end or walk around in an ataxic or drunken manner, the more chances we're going to have of disrupting that scar tissue in the spinal cord, as well as causing compensatory issues in the rest of the body, front end and sores from dragging toes and things like that. The other consideration is flooring. I know no one likes to see yoga mats and carpet runners all over the house, but especially if they are able to walk and are trying to get around, preventing them from slipping is super important. Toe grips and booties and things like that can help them get grip, but definitely having a change in the flooring, even if it's temporary, is important. So supportive devices are another important aspect to rehab patients for neuro. The help them up harnesses seem to be our favorite as far as they're easy to put on. They don't seem to rub in improper areas and cause sores. We can give them a little bit of support if all they need is to prevent them from walking in a drunken manner and back and forth. But we can also give them full support in their hind end until they're strong enough to walk as well. I just wanted to show you this video. This dog here was unable to walk when he walked without the harness and the little setup that we have. He ended up walking completely on the tops of his toes. So this was at least a temporary fix to let him get in and out to go to the bathroom without causing further damage to his feet. Wheelchairs, I know not everyone wants to go directly into a wheelchair. There's a lot of talk of, well, the muscles will atrophy because they won't be using them. But wheelchairs can play a really essential role to getting these animals in and out and giving them a bit of a mental break, doing normal things, as well as the owner. If anything, sometimes all they need is that extra support in a really big dog. Sometimes a help up harness isn't enough, and sometimes the owner isn't strong enough to carry these dogs around. So a cart can give them that mobility that they need. And just as an example, this is this young dog without, we tried to use a harness, and clearly she struggled significantly, and it was hard for the owner to get her around. So we put her in a wheelchair, and she was able to get around quite well. These are the no knuckling socks that we tend to recommend. The patients have to be fairly strong in their hind end to be able to have them work, but if they are able to stand and the primary concern is knuckling or dragging of the toes, they can play a super important role in preventing those secondary issues and trauma to the feet. So what can be used at home? When patients can't walk or stand well, these rehab exercises let us help keep joints mobile and help prevent atrophy. Many of them can be performed either lying on their side or in a standing position with support, and we'll talk about how to make some supports for different size patients. Massage, range of motion, stretching, all of these things can be super important, especially early in recovery. So you don't have to be a massage certified technician to be able to perform massage. I often have my clients pick up these little vibrating massagers at Shoppers or Home Health or even the Superstore, and just rub it along the back legs or front legs as well if the front legs are affected. It helps relax them. The dogs tend to tolerate it fairly well, stimulates proprioception, promotes blood flow and circulation, and the dogs seem to like it. So PEMF loops, or pulsed electromagnetic frequency loops, are, we have found great success with these, especially with IVDD dogs, either in a conservative management standpoint or post-surgery. So we have a lot of patients that have multiple discs that are affected that we're trying to manage, and because they are anti-inflammatory and approved for pain, they work very, very well. They are limited in the number of treatments that they have in them, so they come with a preset time. So you hit the button, you place it over the area, and it treats for 15 minutes. They do have beds that are rechargeable, but they're significantly more expensive. However, they are available. Currently, with the COVID-19 crisis, a CC has waived the veterinary prescription, and as long as clients tell them who their veterinarian is who recommended it, they will email or mail them directly to the client. So it's definitely a good option. Range of motion and stretching are one of the biggest things that we do with these neurologic patients until they have a little bit more mobility in their back end and are able to stand. It helps keep those joints loose and prevent contraction, helps promote blood flow. The biggest thing is supporting those legs, and I'll show you in our little video. So just notice how she constantly is maintaining contact with 2 different points of contact on the dog's leg. She's flexing and extending all of the joints. And sometimes too, when you extend that leg back, and if you're doing a little bit of a bicycle, if you tickle their toes and they have a little bit of feeling there, they will engage and bring that leg back, and that sometimes helps those muscles start contracting and helps reconnect those that nervous system again. So it can also be done if they are a little bit stronger and they're not painful. So we don't tend to do this in an acute or sudden in the beginning phases of IVDD, but if they are comfortable being placed over a support like a peanut or a roll of towels or something like that, you can get a standing range of motion, and I'll show you here. We are actually dragging the toes against a rough surface to get engagement. So you can see as we bring it back, the dog is helping and bringing the leg forward. Until they are a little bit stronger and able to stand, this is something you can easily do at home until they're able to walk and get a little bit more mobility. So these are some of the homemade supports that we have made at SOAR. The one on the left is a pool noodle that we've bubble wrap and then duct tape around. You can make these for various sizes depending on the amount of bubble wrap you have. Any real material can be used, but it tends to be fairly easily tolerated and then wipeable if there is some incontinence present after the injury. The one on the right is a bunch of pool noodles with some yoga mats and duct tape. And again, you can be fairly inventive with how you make them and the size that you make them. But definitely these are options. It doesn't have to be expensive. You can buy these things at the dollar store. So the other thing is standing. Again, remember, before you walk, you have to be able to stand. And so whether that means assisted standing and using a harness or putting them over a support and weight shifting them back and forth, getting them up and standing is beneficial. Once they're able to stand, even with some support, you can do 3-legged standing. So lifting one leg to make them bear more weight on the opposite leg and just engage those muscles. TENS is something we use regularly with our neurologic patients. You can buy, and you can see on the right, there's a couple different options, and you can buy them on Amazon often. Some of them are just TENS, and some of them are more muscle stim, which we'll talk about in a minute. And again, most rehab places in the area can help guide referring vets or clients on where to put these pads. We often will shave spots for the owners, so at least you know where to put those pads, and then we'll provide the settings that we want you to use at home. You can use TENS multiple times a day, and muscle stim you can use daily at home, and it just helps bridge that gap between appointments, especially in this current situation. So neuromuscular electrical stimulation, is also a pretty useful tool. What it does is it tells those nerves to tell the muscle to contract. So before we have that reconnection in the spinal cord and get those muscles contracting, this at least we can do this locally. So this is what that looks like. This is a kitty cat that we used it on. Just getting those muscles to contract, and then the other one was on a little dog that was recovering from spinal surgery as well. Laser therapy, again, is another great option. We use a lot of laser in our clinic. Many rehab facilities do. They can range from a class 3 to a class 4. Unfortunately, those lasers are a little higher powered and not usually available to the general public. However, the LED lasers are starting to show a lot of positive research and penetration to the spinal cord. So LumaSoothe is one that I was a little more familiar with and have become more familiar with. And it's very well tolerated. They're fairly inexpensive. And again, you can order them on Amazon. I don't recommend using any of these things without talking to your veterinarian first. But if your veterinarian thinks that it might be an option for you, it's definitely something you can use daily at home. So supported walking, so once you get clearance that walking is allowed, then being able to support them so they're not falling all over, either with a sling like Jenna has in this video, or with a help them up harness is an option to get them in and out and do little tiny walks around the backyard. So you can see she just gives a little bit of support. So in a dog that has some ataxia or drunkenness in the back end, it just provides that stability so they're not causing further trauma falling over. And then we have our therapeutic exercises. Now this will depend where your pet is in the stage of recovery and what their abilities are, but as they improve, we can increase the level of difficulty for them. So cavalettis are a great tool, you know, therapeutic exercise balls, fit pause balls. You can order even the human ones and use those at home. They're pretty easy to find on Amazon and order. And even three-legged stands, all of these things to improve proprioception and balance and strength. So this is what it looks like as far as cavalettis. They have to do a lot of organization to get over these poles, right? You don't realize how much, but to think about where each one of the 4 legs is being placed is something that neurologic dogs are lacking. And so the more we do that, the more we train them to understand where their feet are. So land treadmills, a lot of people have at home. And clearly not everyone has a water treadmill at home, but land treadmills can also serve a great use, especially if you have a help them up harness or something to support them. Then, and again, with 2 people, sometimes it's even easier. So if someone can hold the harness and someone, especially if they're not entirely moving their legs in a normal pattern, can move their hind legs for them in a slow kind of just a couple minutes on the land treadmill. Again, consulting with a rehab practitioner is highly recommended and they can guide you. But definitely this is an option for something that you can do at home. Sit stands are something else. Now, Scout is doing a sit stand that is a little more challenging because it's on a fit pause peanut, but these can be done even sometimes with assistance. So having them with their harness and helping them into a sit position until they're a little bit stronger, can do it on their own. And I would start on a flat surface and then we graduate them to more difficult sit stands. As you can see, Scout is working very hard. Again, this was not in the acute stage when she was painful. This was significantly later in her neurologic recovery. So these are the options that we've kind of come up with as a general assistance for you guys at home. Know that these neurologic cases, as stressful as they are, respond very, very well to these therapies, and combining medications that your veterinarian has prescribed with some of these other things can improve the overall response dramatically. There's so many options either before or after surgery. And remember, these really need to be under the advisement of a veterinarian and or rehab practitioner ideally, and whether that's through telemedicine or an appointment if one is available to you, they are highly recommended. If you have any questions, please don't ever hesitate to give us an email or a call. We'd be happy to help. Everybody stay safe.